So how can the NHS involve patients as well as clinicians in decisions about the care provided? Will this principle of shared decision-making and no decision about me without me actually become the norm? Now, Jenny McCrorie, as a person who represents the patient voice, what is your gut feeling about whether there really is going to be more choice?
I'm not convinced there's going to be more choice. I think there's going to be definitely more involvement. I think the choice is there now. It's just accessing the choice. Does that make sense? It's more that people need, I think it's what we were talking about earlier, people need to be more aware of what's available.
That they have that right.
They have that right, and they can say it. I think the other thing is people these days still are thinking talking to the doctor is scary. Talking to the doctor is, they're the person in charge. But patients shouldn't be feeling like that. Patients should think it's a joint partnership. We should be working with the doctors and they should be helping. It's a joint partnership in decision making in our clinical treatment as well. And I think that's the important thing that really goes along with it. And I think patients themselves need to feel a bit more empowered. And I think they need more knowledge. And I think it goes back to what we were saying earlier. Patients don't understand what's happening to the NHS at the moment. Patients don't know what's happening with the consortia. They don't know what's happening with their GPs. They don't realise that things are changing, most of them.
Is that what you would share is actually the impression that you get from your patients? They don't really understand what's happening?
I'd certainly share the fact that patients should be absolutely involved in all decisions about their care. And of course, medicine's changed a lot. Again, it's an evolutionary process over the last 20 or 30 years. So if you used to go and see your doctor in the 60s, 70s, it was quite doctor-centred. So there was an imbalance in the relationship. You know, in transactional analysis terms, the doctor was the parent and the patient was the child. Now, we've been on a journey, partly through the intervention of the RCGP. So in the MRCGP exam, and every GP trainee has to go through this, we're very much taught to involve the patient in every decision that we make with them. We always ask them, what do they think? What would they like? So this strapline of Andrew Lansley's "No decision about me without me" is something that's been going on in GP world for the last 20 years,
it's
I would
reinventing
say.
the wheel.
Yeah, so in terms of involving patients in their healthcare and the decisions about their futures, GPs are already well adapted at this skill.
Now, patients are going to be able to choose, aren't they, Sue, which consultant leads their care in hospital. Do you think trusts are ready for this degree of patient empowerment?
I think trusts will welcome it once the tools are there for patients to use it. I think we're probably some way yet from having the sort of data to provide for patients that would really allow them to make that choice about which consultant is going to provide the best care. But I think the key for patients is that what they want is quality rather than choice. And we have the same debate in education, that what parents want is for their local school to be excellent. And then they're not worried about having a choice of many others. And certainly for the population that my trust serves, who do tend to be quite parochial, what they want is to use their local hospital, but they want to be absolutely certain that their local hospital is providing excellent care. And that's what I think most hospitals are working really hard to provide.
I mean, Ian, don't you think that choices sounds great? It's a great selling point, but in actual fact, just as Sue said, what people really want is to get the very best on their doorstep.
Yes, they do, but I think the key to this is actually about information. I did some work a number of years ago when we looked at why patients were choosing to go somewhere other than their local hospital in a different part of the country, and the answer, rather worryingly, was car parking. Now, we didn't introduce the concept of patient choice simply so that people could choose to go to a hospital where they park the car. The concept of choice is to allow quality to be driven up by people choosing to go to the provider that offers the greater clinical quality of care. But I think the points that have been made are absolutely right. We don't yet have the tools and mechanisms in place to allow members of the public to make an informed choice. GPs play a huge role in this, and GPs clearly know a lot about the local area and the local services. But making information available to patients in real time is going to be fundamental. If I were to be referred for acute surgery, let's say, I would do my homework. I would ring people. I would ring friends. I would say who's best for this.
Yeah, but you would know that, wouldn't you?
I would, but we need to make that available to the public. That's what choice is about, but we've got some way to go before we get there.
I mean, when we hear this debate about choice, interesting the analogy that you just made with education. And parental choice means that some schools lose out because parents vote with their children's feet, go to another school. Is there a fear that, you know, some healthcare providers might lose out if patient choice takes on? And, you know, they go one way and not the other. That'll weaken some providers.
Well, can I give you a specific example of that? Mid Staffordshire Foundation Trust, clearly in the news at the moment for the public inquiry into the scandalous happenings there in years gone by. Somewhere in the region of £10 million worth of patient care activity is going away from that hospital to neighbouring hospitals because patients and GPs are choosing to go elsewhere because they're concerned about the quality of care being delivered.
Do you think that's 100% a good thing, Jenny, when you hear that?
I do, actually. I think patients should go where they think they're going to get the best care. But patients, I could still go back, patients need to be aware and they need to be informed. And patients aren't being informed of where to go and what to do. The GPs do, but I don't think they've got enough information available to them. I mean, yes, you can do your choose and book, but you have 4 consultants to have a choice of, and that's all you have, 4 hospitals, and you can go down. I've done it numerous times, you can tell. But you can go down the little list and you can say, well, that one's waiting. And all you go by is waiting times. You don't go by anything else apart from waiting times when you're choosing.
Well, this is the discussion of what patient choice actually means. I'm going to really ask the audience here. You know, choice does sound great, doesn't it? But it's also going to mean that people vote with their feet, that it might weaken some services, it might skew people's opinions of some providers. I mean, how do you think that patients can become more involved in practice? You know, surely clinicians do have to be in charge. Is patient-led choice always a good thing?
I think that choice is not a good thing. I'm putting my neck on the block here, but that's because the choose and book system, for example, GPs in the past knew who they thought was a good clinician with good quality care standards and so on, and the choose and book has got rid of all of that. So I would get patients in my clinic who have come along who are not necessarily my area of interest, and I've then got to move them along to somewhere else. So it's giving them less choice or giving them a different choice to what they had actually come because of the waiting time being shorter, for example, but it's not actually my expert area. And I think that most doctors and GPs will know who they want to send to, but that has been taken away from them because of the choose and book system. And I think that patients will rely upon doctors to actually direct them properly, and that choice from patients is not really something that I think patients want.
So it's really about informed choice. Can I just put that to Vicky? As a practice manager, do your GPs choose which hospitals they use?
We have extensively used the choose and book service with patients, but ironically, just to give a sort of counterbalance, I did have a letter from one patient actually saying that she was dismayed the doctor had asked her opinion. That's what she'd gone to him for. And so, you know, you do see both sides of this, that choice is a good thing and informed choice is a good thing, but actually patients very often are looking for direction as well from the doctors. And the doctors, I feel, you have to ask them, but they feel that they have to offer choice and can't always lead a patient as much as they would, because we are marked for how much choice that we give patients. The only other thing that I think might help patients in future that I know that is coming in is the quality accounts system, and that every practice, so talking primary care here, will be submitting quality accounts to inform the public exactly what services they have delivered and what they intend to look to improve and how they're going to deliver it in the future, and that will be available on NHS Choices so that people are informed. So we're moving that way.
Now, Dr. Anna Hughes, just sitting behind, you're listening to this discussion about choice. Now, you are a junior doctor, you're in your first sort of foundation year, is that right?
Yeah.
Have you been taught about patient choice? What does it mean to you?
Well, we were certainly trained in the importance of patient choice and the need to enable them to make their own decisions and to involve them in their care. But that was with regards to treatment options, so treatment A, treatment B, or no treatment. It didn't include Doctor A, Doctor B, Centre X, Centre Y, and I'm not sure how we could really learn about that in medical school. I think we ourselves don't necessarily know all the services that are available, and we won't really find that out until we start work. So I don't really know how we could further that training.
Francis, you're a nurse. You're at the beginning of your training. Can you tell me what you think patient choice means? Are there lectures on patient choice that you attend?
We had an assignment to do, which was like, you had a patient and they were looking at different, they had a long-term condition, and they were asking for advice and obviously dropping hints. They were smoking cannabis and things, and you had to point them in the right direction. It was like giving patient empowerment and how it's
like a detective game.
Yeah, and you had to empower your patient. So I had a patient who had MS and was using the website to identify any change in his condition. But obviously it's making sure they're using the right websites to go on to look for information and things like that. So
this sounds like informed choice being taught, doesn't it? Supported choice. What do you think of this?
I just think this is all wrong.
Why is it wrong?
Well, all this, everybody wants the doctor to decide and all that sort of, I don't think that's right at all.
It's not right that it's not true that that's what patients want, or that it shouldn't be that way.
Well, I'm a patient as well as a doctor.
Yeah.
And actually, I do want to be consulted. I want to make a choice between whether I decide or the doctor decides. So I want to be offered the choice. That doesn't mean I want to be abandoned on my own to make the decision, because I want the doctor's expertise and knowledge and things put in front of me, so that my decision might be to say, no, doctor, you decide. So when I had a problem and I went to my GP and he said, well, I think you need to see somebody. Who do you want to see? He said. And I said, I'm the patient, you're the doctor. What would you say if I weren't a doctor? And then I'll think about it. So we had that discussion, and I think that's where we want to be. Some patients do want the doctor to decide, but some don't. And I don't think we should make the assumption that because some do, everybody does.
Can I just ask Tom McLaughlin-Yip, now you're from Birmingham East and North Action Group. Yes. You work with patients to improve their access to decision making, and you're also a cystic fibrosis service user. What is your take on the impact that these changes to the NHS will have on patients that you speak to and their perception of the choices, the empowerment that they're about to be given?
I honestly don't think choice is going to change from where we are now to where we'll be in 2 years' time. I think it will still be the same system that we operate now, and mainly because we're not passing on that knowledge and information to the person who's in the consulting room to gauge an understanding of where they want to have their treatment, what pathway or which way they want to go with their treatment. And I think that's the nuts and bolts of it. If we can get to that stage where we can offer them the support to make an informed decision. If it's somebody like myself, I can make it a fairly quick decision because I know how to ask the questions that I want to get to understand where I'm going. But if it's somebody less able, with less knowledge in the healthcare system, then it's going to take more time. So it might be that the GP does not necessarily lead with all of the discussion. It might be that a nurse practitioner or one of the other people within the disciplines educates that patient to get to a stage where they're making an informed decision, and it's something that they're comfortable with. And I don't think we're ever going to get to that stage until we get disciplines working together.
Can I just come in on that comment? Because I think at the risk of taking this debate perhaps into a much broader area, it's not just liberating the NHS or government policy that's going to determine this. It's the society we live in. If you think about the globalisation of healthcare, I can go to a computer now, enter my credit card details and have an online consultation with a doctor in New York.
Is it what you want?
It may be, but I can therefore be much more informed. I can then take that information, I can then go and sit down with my GP and have a discussion on the basis of already having had a second opinion, as it were. So the impact of Web 2.0 technology, the impact of the digital explosion, the way in which we interact with the health service is going to change beyond all recognition. And I think the idea that the way in which we interface with healthcare provision is going to be the same in 5 years is just completely not true. And therefore choice, yes, it'll be driven by the availability of more information, but I think much more importantly that it'll be driven by society.
A very quick word to you, Doctor.
I completely agree with Ian. There are these huge changes in our society. In many different areas, we're seeking to make an informed choice, whether it's who we vote for at the general election, whether it's a film we go and see. Maybe even before we go to a restaurant, we look to see if there's a review on the web now. Whether we buy a book from Amazon, we see what people are saying about it. That there are these huge societal changes. So I think, and again, that Ian is right, that very shortly, general practice and any provider in secondary care will be open to far more scrutiny. Locally, as an example, in South Birmingham, the so-called balanced scorecard has just been published, which looks at every one of the 66 practices in South Birmingham and looks at a huge range of quality data, and this will be freely available on the internet. So, for instance, in independent surveys, not everyone might agree with this, but the patients are asked about their satisfaction with their doctor. Now, locally, the satisfaction with doctors varies from 70% in some practices all the way through to 100%. Now, for a patient moving into an area, which practice would you like to join?
Well, at that point, ladies and gentlemen, thank you very much.